On behalf of the countries and partners of the Network for Improving Quality of Care for Maternal, Newborn and Child Health, I would like to welcome you to the session on Learning from Implementation, National Forums on Improving Quality of Care for Maternal and Newborn Health. My name is Berta Malici, and I lead the Secretariat of the Network, which is based in the WHO Department of Maternal, Newborn, Child, Adolescent Health and Aging. In 2017, 10 countries, together with WHO, UNICEF, UNFPA, and the Coalition of Partners, established the Network for Improving Quality of Care for Maternal, Newborn, and Child Health. The network embraced the vision that every pregnant woman and newborn receives quality care with equity and dignity. The 10 network countries committed to halve maternal and newborn deaths and stillbirths, and to improve user satisfaction in health facilities by following the strategic objectives of leadership, action, learning, and accountability. 4 years later, the network countries have made important progress in building systems and scaling up quality of care for maternal and newborn health. As part of their efforts to document and share learning, this year, the network countries will embark in organization of national forums on quality of care. Among others, the national forums will aim to document and share experience in implementation of quality of care for maternal and newborn health, and discuss implications for scaling up at the subnational and national levels. The objectives of today's session are to share initial lessons identified by the network countries during their quality journey, and to seek your participation to identify key topics that the network must document and share as part of its contribution to the global knowledge. The session today is organized in two parts. On the first part, we will hear from different speakers who will try to explain what countries have learned from implementing and scaling up quality of care for maternal and newborn health. First, we will hear from Dr. Anshu Banerjee, Director of WHO Department of Maternal, Newborn, Child, Adolescent Health and Aging, who will share the key findings from the implementation of the network. Then, two distinguished panelists will share with us their observations and lessons learned. And they are Dr. Salma Anaskolo of Federal Ministry of Health Nigeria and Dr. Isabella Sagomoses of Ghana Health Services. This part of the session will be facilitated by Dr. Tedbabe Hele Gabriel, Senior Advisor, Maternal and Newborn Health in UNICEF, New York. The second part of today's session will focus on what should be the national forums objectives, what should they document and share as a contribution towards global knowledge. Dr. Nuhu Yaqub and Mr. Martin Dolstein of WHO will facilitate this interactive session, during which we will work together to identify 4 most critical topics that must be prioritized by the national forums and the Network Global Forum in 2022. At this point, I'd like to invite Dr. Anshu Banerjee to share with us the initial results of the Network Progress Report. Thank you. Dr. Tedbabe, over to you.
Yes, okay. Thank you, Berta, and we apologize for this inconvenience. It is a great pleasure for me to moderate this session. So in this part, we will be sharing 2 country examples from Ghana and from Nigeria. And I am joined here by 2 esteemed panelists, Dr. Salma, who is the Director of the Family Health Department at the Federal Ministry of Health in Nigeria, and also Dr. Isabella Sagomoses, who is the Director of Ghana Health Service MNCH Department. So the first speaker will be Dr. Salma, sharing the Nigeria experience. Dr. Salma, the floor is yours.
Can you hear her? Can you hear? You can hear me now. So let me just quickly, as you all know, Nigeria is the most populous country in Africa with very high maternal mortality ratio of about 500 and 1,200,000 live births. Over 50,000 women die every year from the NDHS survey of 2018, and Nigeria is the second contributor to the global burden of maternal deaths and ranks highest in Africa. Next slide, please. I just want us to have a quick look at the trends from 2008 to 2018. You can see that we have not been making a very good progress. The progress has been very sluggish. The total fertility rate just declined from 5.7 to 5.3 over the period of the years that we are seeing. And the contraceptive prevalence is still at about 12%, which is far cry from our expectations of achieving 27%, according to the Sustainable Development Goal by 2020. Most women in Nigeria do not have access to skilled-birth delivery. It's still at about 43%, and majority deliver at home, with only 39% of women having access to delivery at health facilities. So looking at the childhood indicators, we can also see that some progress have been made, very slight, in the area of infant mortality, which has slightly declined, and also under 5 mortality. But vaccination coverage is still very low at about 31%, and then the neonatal mortality has not made much progress. It's still very sluggish. The rise is just about 40 to 38%. Next slide, please. Yes, so I'm glad to share with you the status of quality of care implementation in the country. We've been able to establish 112 sites across 12 states of the Federation, with 3 general hospitals, 3 at general hospitals, and then 6 primary healthcare facilities per state. We are also collecting data on a monthly basis, which includes process indicators, QED network core indicators, and program management data. I'm glad to mention that the country have established technical working groups at the state level, and they do meet on a quarterly basis. Some progress have also been made in setting up coordination structures, formation of QOC committees, and we have been able to conduct some step-down training on quality improvement. Next slide, please. We can see that in terms of implementation milestones, looking at the 4 thematic areas under the national level planning. We have supportive governance structures and have developed national and state technical working group levels at the state level and also at national level. We have also the RAMCA, the RMNCH Quality of Care Strategic Plan, has been approved by the National Council on Health, and a roadmap have also been developed to that effect. We've developed some standard QOC materials, and then some packages have been developed. We are currently working to ensure we include the pediatric standard packages as well. On the learning side also, it is good to note that quality of care coaching manuals have been developed and are being used to train on quality improvement, training for the coaches. Looking at areas of measurement, baseline assessments have been done in 2018, and these have been used in 113 health facilities, using common data sets as indicators that have been agreed upon. We've also been able to develop an indicator dashboard. However, I must mention that we are also struggling to ensure that we have an effective mechanism for community participation as an integral part of QLC. We are currently working to identify and agree with academic and research institutes to facilitate documentation. Please, next slide. We have learned several lessons, but most importantly, we realize that there is need for leadership and effective coordination around quality of care to ensure sustainability. We also note that quality improvement initiative cannot exist on its own without other health systems interventions to achieve meaningful improvements. Well, some of the lessons learned are also there is need for continuous training of health workers linked to quality of improvement. And then under accountability, and we realize that an updated DHIS platform supports local government, states, and federal levels to track progress made on quality improvement. The good lessons we've also learned is on community participation. There is need to link community participation to QI activities at health facility through a two-way referral system. All these have not happened without challenges. The major challenges we observed were around the weak health systems, particularly health information system infrastructure and inadequate skilled staff with weak coordination mechanisms. But most importantly, the major challenge has been around sustainability, sustaining efforts of development partners as project closed out. So we have made the following recommendations in the country. And moving forward, there is need to rapidly scale up quality of care initiative in all the states of the Federation because we have focused on a limited coverage. There is need to collaborate with academic institutions in all the regions of the country for research and mentorship. There is need also to strengthen coordination mechanism using our existing RAMCA platform. We've also recommended that federal government need to go into intensive advocacy activities to state governments and also private sectors for more ownership and sustainability. We recommend the need for continuous monitoring and result sharing and the need to strengthen data management and feedback into the health systems. So far, these are some of our recommendations and the lessons we have learned. We look forward to more interactive sessions during the Q&A and more partnership with WHO as we strive to improve quality of care around maternal, newborn, and child health in Nigeria. Thank you so much.
Thank you, Dr. Salma, for this excellent presentation. So now Dr. Isabella Sagamusis will share the lessons from Ghana. Dr. Isabella, the floor is yours.
Thank you very much. I bring you warm greetings from Ghana, and we are happy to share the lessons we've learned whilst working at improving quality of care for mothers and children in Ghana. Next slide, please. Next slide. I'll start by sharing some of the key actions that we have taken, starting with a strong national leadership that has been built through national dialogues, using various existing fora to build momentum around the need to improve quality of health care among both governments and stakeholders and partners. We have also further developed a national quality healthcare strategy, which was launched in a big event with all key stakeholders present. Following that, we developed national operational plan and a quality of care roadmap. Then we also developed, as the Ghana Health Service, which is the main public service provider for health, we developed operational guidelines emanating from the National Quality Strategy to guide our service provision and our efforts around quality improvement. We've gone ahead to adapt the WHO standards for improving quality of care in health facilities. And from that, we also have an implementation guide and tools and guidelines for use by facilities seeking to improve care at their level. We have also recently developed one national reproductive maternal newborn child strategic plan with quality of care as a main focus. Next slide, please. We've gone ahead to include newborn care standards in our National Health Insurance Authority and health facility regulatory bodies credentialing tool. We did this to ensure that standards will be monitored regularly, as these bodies are mandated to work with facilities and ensure that they are operating according to standard before they are credentialed or accredited to work in Ghana. This also ensures that not only public facilities will be motivated, but also the private to adhere to the quality standards that we are all working towards. We work very regularly with professional associations, training institutions, especially with pediatrics and obstetricians, whose area we are talking about here. And they are with us all along the way from the national level down to the health facility level. Community involvement has been key, where we have developed a community scorecard by which community health management committees tell us how they feel about the service that we are providing. They give us valuable information around the experience of care, and whatever they score us is linked to our health management information system for managers to see and take action to address gaps. Next slide, please. In scaling up quality improvement nationwide, Government has not done it alone. The UN agencies, mainly UNICEF and WHO, have been with us, jointly planning, jointly implementing, and working towards our goals. But we've also had a number of partners who have been with us from the beginning. Currently, most of the projects have folded up, but we still have some of them with us. So with that, we've been able to move from one region where we had only 4 implementing districts to currently 5 regions with 30 implementing districts. Next slide, please. So the quality improvement interventions that have been implemented have centered around improving infrastructure, institutionalization of quality improvement, and implementation of various other interventions. We have had to look at infrastructural gaps, such as providing space for kangaroo mother care, newborn units, making sure we have the requisite equipment in place, making sure that wash facilities are available and to serve both staff and our clients, and also making sure that we are in link with the community to be able to provide outreach services and home visits where necessary. Mentorship and coaching have been also a major focus of our quality improvement, as well as audits, perinatal death audits, maternal death audits, with various recommendations that facilities work towards improving. And then we have others in the implementation interventions that are listed under implementation, including triaging and referral. Next, please. Now I'll share the key lessons that we have learned as we go along. We've been able to convince ourselves that QI interventions do save lives and should be the thrust for achieving sustainable reductions in mortality, since a number of our sites have been able to demonstrate reductions in mortality for both newborns and mothers. Leadership is very important, and we are talking about leadership at every level, from the national level right down to the facility level. It is important that leadership at these levels works synergistically to be able to achieve the aims that we have set for ourselves. And also fully integrated QI coaching models help to support care at the lowest level, especially in settings like ours where access to care and to specialized human resource capacities are limited. So where we don't have specialists, we are able to link facilities with coaches from nearby regions who support them and help them get over various issues. Data is also very important. And as we started, we worked towards improving data. And what that does, what we've seen, is that initially you would think that things are getting worse, but it's only because we are capturing what is happening better. And if you persist, then you would eventually see the improvements as we are seeing currently. So it calls for sustainability and focus on what we want to do to be able to show improvement. Community engagement, as I've talked about earlier, is also very important and serves as good accountability from us, the care providers, to our clients. Next. Thank you very much, and we will be available for further discussions if there are questions. Thank you.
Okay, thank you, Dr. Isabella. Actually, we'll go back to Dr. Anshu's presentation, and then we'll come back to the question and answer session, and we will take the questions for the 3 panelists.
Thank you very much, Blerta, and it is a pleasure to be part of the meeting today. I'll highlight progress made by the Quality of Care Network and the initial lessons learned from the last 4 years. The report details how the network was conceived and its implementation approach to quality of care for maternal, newborn, and child health. It presents progress towards the achievement of network strategic objectives and highlights successes and challenges to inform implementation at scale within the network and beyond. To implement its vision and to achieve its targets, the network articulated and is driven by 4 strategic objectives: leadership, action, learning, and accountability. The strategic objectives describe what needs to happen at the country level to improve quality of care. In response to the network's strategic objectives, network countries and partners co-developed an implementation approach underpinned by principles of government leadership and multi-stakeholder partnership. The approach emphasizes the need for an overall strategic direction for quality health services with maternal, newborn, child health as an entry point. The implementation approach also emphasizes the need to use and share data to guide implementation, monitoring, and progress and accountability. What has been the progress so far? Implementation at the country level began with a focus on leadership. Activities were then directed towards action, and then the learning agenda was rolled out more recently and is still evolving. Along with the successes, however, there are still persistent challenges, notably those related to quality of care measurement and monitoring to demonstrate impact. This is mainly due to insufficient resources to support gaps in quality of care data and data systems, lack of a critical mass of health managers and practitioners with the requisite skills in quality improvement methods, and continuous dependency of countries on partners' technical assistance and financial investments. I would like to highlight a few points. On leadership, successes have been: 1, keeping quality of care at the top of countries' national health agendas; 2, the development by all countries of a national quality of care policy and strategy and its related quality of care roadmaps; and 3, governments dedicating domestic funding to operationalize quality of care support structures. Flexibility has been fundamental to this success. On action, the WHO maternal and newborn health quality of care standards have been adopted and adapted by all network countries. The related quality of care intervention packages are diverse across countries and reflect the implementation context and priorities. On learning and accountability, a set of common quality of care indicators was successfully agreed to be monitored, and progress is being made in establishing quality improvement learning systems at local levels. Countries have also made progress in developing community engagement mechanisms and related accountability platforms. What are the lessons? First of all, it takes a whole health system to improve quality of care. Second, government leadership and long-term commitment is a prerequisite for success and critical for aligning partners and investments and allocating domestic resources. And third, quality of care requires dedicated and sustained investment and partnership to align partners around the government's drive for quality of care, including predictable and continuous technical assistance. In relation to action, health systems operate in different contexts which impacts the pace of quality of care development, adaptation, and implementation. Improving quality at the point of care will only bring about small-scale changes if systematic and resource gaps are not addressed. Building quality improvement capabilities is important for accelerating improvement in the provision of quality of care, for example, in pre-service education or within health services management. In relation to learning, designing, implementing, and monitoring a comprehensive and adaptable quality of care program at the district level is critical. we will not see impact if the program is poorly implemented and not monitored. It's not context sensitive nor adaptable, or if all key stakeholders are not engaged early. Documenting and sharing lessons can help build more effective programs. Trust is critical for the sharing of lessons within and between countries. The network offers a valid and trusted platform for rapid South-South learning and accelerated progress in quality of care. And in relation to accountability, investing early and intentionally in the development and strengthening of data systems for quality of care is essential. For example, integrating relevant quality of care indicators in routine health information systems strengthens accountability for quality of care. Demonstrating impact of quality of care activities takes time. Moving forward, the network countries must build on the results so far to institutionalize, sustain, and scale up quality of care within national healthcare systems. The countries will have to invest even more in quality of care, including strengthening their health information systems. There's also a need to strengthen accountability mechanisms. The involvement of academic institutions will be critical to support the development and implementation of a national learning platform. And finally, the experiences so far are already informing the development of fresh normative guidance on how to implement quality of care programs. This guidance is being used to inform scaling up quality of care activities within and beyond the network countries. Thank you.
Thank you, Dr. Anshu, for that excellent presentations and lessons from the last 4 years. So now we will have answers and questions. So my first question will be for Dr. Anshu. So today we've learned that over half of maternal and newborn diseases can be prevented with quality of care. So based on these lessons learned from the network countries, should the countries wait to develop quality of care strategies and structures to address quality of care for MNH? What do you say?
Thanks, Debabe. And I think it's crucial to understand that those countries that have invested very much in improving services or increasing access to services don't always have had the impact that they were looking for. So we've had countries that increased institutional delivery, but without addressing the quality of care that was provided in these institutions, actually we saw that there was no decrease in maternal mortality. And so that means that this has led to huge inefficiencies. And I think that when it comes to universal health coverage, quality is core to universal health coverage. And that when countries look at increasing access to services, increasing the package of interventions they're making available to the population, they need to make sure that they are provided with quality, because otherwise it's an investment that not really brings the returns that our national governments are hoping for. That's, I think, very important. As already highlighted in the presentation, it's very important that also there is a system that is built around it. So, for example, we can invest in trainings, we can do in-service or pre-service training, but if the health system doesn't allow the healthcare worker to implement or to implement the newly acquired skills, then basically it doesn't have an impact on the quality of care, on the service delivery, and basically again there it was a huge inefficiency because the healthcare worker was out of his or her facility, didn't actually provide services, and when coming back could not actually implement those. So I just stick to those first few points.
Thank you, Dr. Anshu. Well said. So we have, a few more questions. So in the interest of time, I will just, select few. So for Ghana and Nigeria, the questions were related to processes. some of our participants wanted to understand if there is a quality of care guideline in those implementing facilities. I think both of you can answer for this question. And for Ghana specific, if you could speak on the scorecards, how they were developed, how they are used, if they are available in every facility. So Dr. Salma, you go first, and then Dr. Isabella, you can pick up the next.
Thank you, Ted. Thank you, Ted Babi. Yes, I think I can respond to that. In Nigeria, we've developed the strategy, and we've adopted the WHO guidelines, where at the state level manuals have been developed from the adaptation of the WHO training manuals, and this is what has been used for training of quality of for training of what we call the coaches, the quality improvement coaches at the state level, and they also use it to step down training at the state level. So this is what we have been using at the moment at the country level, but we're trying to put it together to have it as an overall national training manual on quality of care. Thank you. I hope that answers the question raised.
Thank you, Dr. Salma. Just to add, more so that when you respond, Dr. Isabella, you talk about, when you talked about the scorecards, just to explain if it includes respectful care, if indicators on respectful care are also included on those scorecards. And also, if you could speak, what challenges you faced in implementing those scorecards and how you overcame those challenges. Dr. Isabella.
All right, thank you. Yes, so we also have quality improvement implementation guides. We have the overall national strategy. Then we have the Ghana Health Service implementation guidelines. These spell what structures must be put in place from at every level down to facility level and the various rules. Okay, so those are the ones that guide implementation. Then about the scorecards, we have the RMNCH scorecard. That one has the usual indicators, maternal mortality, neonatal mortality, and so on. And we populate it and share on a quarterly basis. And together with the indicators, we have action points, and plans are entered online for everybody to see who is responsible in addressing a gap. And one can also follow when the necessary action has been taken. For the community scorecard, we started using that just about 2 to 3 years ago. And yes, that one has the experience of care indicators. So indicators such as respectful care, waiting time, whether the needed essential medicines are available. So the communities score us. There's a committee in the communities that score based on their experience over the quarter. And they have just 9 indicators, but they are very, very critical. For example, in one instance, they told us a particular health facility, there's never anybody available over the weekends, or they just go and wait forever. And this is loaded onto the system. Again, managers, district managers see it, regional managers see it. And so the health facility workers have to respond and put in measures to correct what has been scored. And in many cases, I must tell you, they work hard so that the next time they are scored, they don't lose on whatever they didn't perform well on before.
Yeah, very powerful, very powerful. Thank you.
Yes, it is.
Yeah, thank you, Dr. Isabella. Maybe one more round before we move to our next session. Okay. If both of you could speak to community engagement. It has been identified, by all of you that it is key. So what has been done to ensure women and youth are fully engaged? If you briefly respond to that, and then we will move to our next session.
Can I go ahead?
Please go ahead, Dr. Isabel.
Yes. So with the women and youth, because we have the community health committees who score us, they are in touch with the community directly. So they hear from the women, they hear from the youth. But with the youth, we also have representatives for every region. We have youth representatives who also report to us at the national level. So, and we engage them very regularly. They have their own meetings where they talk about issues that concern them. So we hear from them. And whenever we are planning for services, we have these youth with us planning, so that sometimes they tell us, no, this way will not work for us. This is what our people will listen to, and this is how to reach them. And we really use them to carry messages to their compatriots.
Okay. Thank you. I think we have to stop here. There is a network session after this, so participants can meet all the panelists and have interaction to ask further questions. Thank you so much for the active participation.
Thank you very much and welcome to the second part of the session. I will hurry up a bit. The aim of this session is for us, we'll work together with you to look at what lessons should be prioritized for documentation and learning by the Quality of Care National Forums. My name is Nuhu Yakub Jr. I'll be doing this session with my colleague, Mr. Martin Dolstein. Next slide, please. As Bletta already highlighted, this year the network countries will be holding national forums where they will be looking to share experiences from scaling up quality of care for maternal and newborn health. One of the key objectives would be to share examples and experiences in implementation of quality of care programs for maternal and newborn child health, and to discuss implications for scaling up at the subnational and national level. So over the next 10 minutes, as we will have an interactive sessions where you will be looking at a list of priority areas which we have selected, synthesized from the report that Dr. Banerjee has just presented, and we'll be asking you to participate in helping to select which will be prioritized. Next slide, please. So as I've said, these statements come out of the reports. We have also consulted with country and partners on them, and they are organized to make it simple around the leadership, action, learning, and accountability objectives of the network, with each area containing about 4 to 5 statements. So the task today will be, when you look at for each objective area, looking at each the statements which are being shown to say which you think is we want to know more about, or countries should prioritize for learning, or we at the global level should prioritize in terms of learning. This will take place on the Mentimeter. So please, you should see already in your chat box, the Mentimeter. If you click on that, you'll see the code 18695370. And my colleague, Mr. Martin Dolstein, will now take you through that process. Over to you, Martin.
Thank you very much, Nuhu. While I'm trying to share my screen, if I please can have the rights to do so. We will ask you to please connect to the Mentimeter with the instructions that was on the slide that you just saw. So maybe Olive, if you can show that slide again so people still can connect while I'm sharing.
Sure, there it is.
Okay, great. All right. So let me share my screen. Thank you very much. So thank you. And as mentioned, we will now continue with this prioritization exercise. And I hope you all managed to join the Mentimeter either through your phone or your computer. So the objective is to prioritize some key topics on what we should be prioritizing for documentation and learning for the National Quality of Care National Forums of the network countries. So these topics are summarized under 4 strategic objectives. For each of these, there are 4 to 5 statements. Now I will go through each of them one at a time. I will present the statement to you.
you will then, by using Mentimeter, vote for the one you've identified as a priority or the most important for learning. When the voting has been done for all the 4 strategic objectives, we will go through the results to see which one you have identified as the prioritized topics. And I'm sure you will understand as we go along, so please follow me. So as you can see on the screen now and also in your Mentimeter, the first one is around leadership, and it's about implementing a system-wide quality of care approach to sustain continuous improvements in M&H service delivery. So the first statement reads, strengthen or build quality of care, health governance and management structures at national and subnational to sustain M&H quality of care actions. The second one, effective alignment and harmonization of partners' activities and resources around a common quality of care M&H agenda. The third one, use the introduction and implementation of M&H quality of care standards as an entry point to strengthen MNCH programming and implementation. And the last one, link system-wide interventions to enable and incentivize implementation of quality of care for M&H at scale. And that would, for example, be update of essential packages for M&H intervention and services. It could be professional regulations, pre-service curriculum updates, regulatory mechanisms, result-based financing, health insurance, etc. So I will just give you a few seconds to read the statement for yourself before we continue to the voting. So now, as we move to the voting, you should now see in your Mentimeter screen the options are available. So please choose one of the 4 statements which you want to prioritize. Select one and press submit. And I will give you a minute so you can reflect before submitting, and then we move on to the next. So we can follow to see how this is going. So we have some votes coming in. Seems at the moment there's a tie between number 3 and 4. All right, some more people voting. Excellent, so 10 people. There's still some time left for you to vote, so please make sure you vote and press submit. So I'll give you 30 more seconds to do the voting before we continue to the next one. All right, 10 seconds. And we will continue to the next one. All right, so the next strategic objective, which is action, is about supporting implementation of M&H quality of care intervention and QI at the subnational district level and point of care. And for here, we have 5 statements for you to choose between. So first one is organize and sustain implementation of quality improvement approaches and processes for M&H at the subnational level. Second one is link learning from M&H QI implementation with management and decision-making processes at the facility and district level. Number 3, leverage existing local health system structures and activities to advance quality of care governance and QI processes. 4th, build QI capabilities of key actors, including district health managers and facility health care workers. And the 5th one, align M&H QOC program interventions with the routine QI processes and efforts and vice versa. So you will now have the chance to vote on any of these 5 topics. So I hope you did your practicing in the previous one, so you will now be ready to vote on this one. All right, so we have the first vote in for number 1. And number 3 is also having 1 vote. Number 5 is picking up. Okay, excellent. Right, seems like people are still reflecting on which ones to choose. Okay, now we have more votes coming in. I will leave you 30 more seconds before we move on to the next objective. So please pick one of the following and don't forget to press submit. Right, 10 more seconds before we move on. All right, thank you. And we move on to the next one, which is about learning. And that's using learning as a mechanism to support scaling up of good practices and interventions. And the 4th statement reads, the first one, establish a subnational, which would be regional and district learning network for quality of care implementation, documentation, and monitoring. The second one would be develop a learning system to support the sharing of quality of care knowledge within and across districts. The third one, build M&H implementation research into QI processes in learning districts and facilities. And the 4th one, scale up the quality of care practices from learning district to others in the country. So please go ahead and make your votes for this one. There we have the first vote in. Second one. Third one. Oh, it's a tie, and number 4 is picking up. 5, 7, and we will soon move to the next one. So I give you a few more seconds to vote before we move on. Okay, so there seems to be a tie between number 2 and 4. So 5 more seconds. Let's see if anyone else can vote before we move to the next. 3, 2, 1. Oh, it's a tie between the 3. Okay, thank you. So we move to the next one and last one, which is accountability, and that's using data to track progress and identify areas for improvement and establish accountability mechanisms based on management. First one, introduce, collect, and report common M&H quality of care indicators, which entails both provision and experience of care. Strengthen routine measurement systems, which for example be facility registers, patient cards, monthly district reports to collect, report, and use QOC indicators to help improve and sustain quality M&H care. Then it will be, the third one is develop and implement tools to collect and visualize QI M&H specific measures and indicators using local information systems as possible. And the 4th, develop and implement accountability mechanism that integrate community and stakeholders' perspective. So please go ahead and vote. And this is the last one. before we wrap up. So the first vote is in. Someone is quick. Number 2, 3, 4. Well, I think people are getting a hang of this now. So we will just leave you with 30 more seconds before we conclude. So if you haven't made your vote yet, please go ahead and do so before we need to wrap up. 8, now we have 10. Excellent. So 10 more seconds. 5, 4, 3, 2, 1. Excellent. Now, please, I will just very briefly go through the results once again. So for leadership, it seems like number 1, strengthen or build QoC health governments and management structures, national levels, national and subnational, to sustain MNH quality of care actions was the most popular one. For action, it was leveraging existing local health system structures and activities to advance QoC governments and QI processes. For learning, it was a tie between the 3. So that's a very tight one. And for the accountability, we had strengthen routine measurement systems, which was to collect, report, and use quality of care indicators to help improve. Very important topic. So we thank you very much for this interaction and helping us to prioritize this. And this will be shared with the network countries for documentation and lessons learned, and also be included in the Network Global Forum in 2022. So over to you, Blerta, just to wrap it up, please.
Thank you very much. Looking forward to meeting with you during the network hour that will start now in a minute. And thank you for the feedback and staying with us despite the glitches. Thank you and see you soon around the network.